Hello, everybody. I'm Dr. Aki Al-Zubaidi. I'm the co-CEO of EON and also an interventional pulmonologist at National Jewish Health. And just wanted to bring up the essential deferred patient care curve again. Going to bring that up here on from the eonhealth.com website. As you can see here today, just going to the eonhealth.com website, and then you go to diversion curves. You can see that today there is 1.8 million office visits that were diverted today. To date, 31 million diverted office patient visits. In addition to that, 6.3 million essential patient visits were missed, and now we're over the 200,000 procedures that are missed. And just wanted to talk again about the importance of hospital efficiency levels and throughput. I think that there is a lot of talk that we've seen over the past 2 or 3 days that hospitals over the next 3 to 6 weeks are most certainly going to be restarting elective procedures in addition to different service lines. And if the hospital are not planning on having separate sections or separate hospitals for COVID positive or symptomatic patients, then what's of the most importance is that they can see these patients safely. And so one thing that we think is going to really hurt hospital efficiency levels is the need to assume that every patient has COVID without testing mechanisms that can delineate that in a very fast manner. So what that means is that the consumption of PPE is going to be at an all-time high when these different service lines open up. And so that underlines the importance of standard operating procedures that move patients very rapidly and efficiently through the hospital. If you are able to get your hospital efficiency level up to 99%, you can see that the ability of the hospitals to actually get through the backlog by the middle of December is actually feasible. So once again, just want to reiterate the importance of efficiency and throughput and seeing patients very safely. Here you can see that the essential patient list without triage is maintained all the way through November, even if you do have a 99% efficiency rating. Why is that? Why is that important? It means that if you just group every single patient together, that you will not be able to effectively see those patients who may have harm in the next 60 to 90 days. There is a subset of patients that do need to be seen now safely, if possible. If you have the PPE and you have the standard operating procedures, you should start to see essential patients now. Triaging essential patients from total patients is what we're talking about. That is most important. And the way that we do that is at EON is with safety net. And so what I want to do is just talk about that for 2 seconds again and reintroduce what is a actual essential patient. Again, an essential patient is any disease or process that would be a threat to the patient's life, a threat of permanent dysfunction to an extremity or an organ, risk of metastasis or progression of a disease or a condition, and a risk that a patient's condition will rapidly deteriorate if the surgery is not performed. And so what this means is that for my pulmonary service line and lung cancer screening, right now, all screening has stopped in terms of new screening at the majority of the hospitals that are our clients and across the nation. So nobody is coming in for a baseline scan. However, repeat annuals are also being pushed off, in addition to some lung-RADS 3. Most people are trying to get lung-RADS 3s and higher in for lung cancer screening, but at some point we need to re-engage the screening population, as there are not only just the annuals for the lung-RADS 1, 2s, and some 3s, but it's everybody who would have got screened in the past 6 weeks that has stopped. And so there's a bolus of lung cancer screening patients that need to be addressed. And then the bigger bolus is of those incidental nodules. Incidental pulmonary nodules are still happening. The follow-up for incidental nodules needs to continue. And then the patients who need to get diagnosed with, who have cancer and need the diagnosis of cancer so that they can get treatment also needs to happen in a very safe manner. Safety net is a mechanism in which we analyze the radiology reports and we identify patients who have incidental pulmonary nodules or a lung cancer screen, and then we segment those patients based on risk, as well as we have algorithms to show the patients who are at risk of never following up, the risk of patients who have the highest cancer risk. And that allows you to sort through very concisely without wasting a lot of time to be able to get that green line. Again, let me just go back to that green line real quick. And this green line here has to go down sooner. So regardless if you're getting SOPs in place and you have throughput, regardless if you do or not, right? Here's hospital efficiency of 88% and here's 99%. One thing to really look at is this green line. Without triage of essential patients who are going to be harmed in the next 30 to 60 days to 90 days versus a patient who can wait 3 months and there's no harm to that patient, then you're still going to have patients that are in that essential under that essential curve out until November, regardless of the elasticity in terms of your efficiency. So again, you have to triage patients that are non-COVID patients that need to be seen now. You need to take this green curve and make it come down before the middle of June to 0. The other curve needs to come down. And as I said, some of these patients are going to make their way into the green because as you go and this backlog is being worked, some of these patients after a certain amount of time definitely will have increased morbidity and mortality. So again, SOPs, triaging with safety net, and increasing your efficiency as much as possible and doing it all safely. We hear that hospitals are going to be reopening in the next 3 to 6 weeks. There is a possibility of there being a reduction in rules in terms of shelters in place, executive orders for elective procedures that's coming at the beginning of May. We just want to stress again, everything must be done safely. You must have enough PPE. You must triage your patients that need to be seen now versus the ones that can likely be seen later without harm. The triage happens with safety net. The efficiency and safety happens with standard operating procedures. We'll over the weekend we'll be working on more data and showing you guys more about how we can effectively triage and get this green line down to 0. Just want to reiterate: stay safe, stay distant, and we'll talk to you guys on Monday. Thank you.